So, Robert, why is the informed consent process so important in dentistry?
I think the best way to answer that question is to look at the impact that informed consent has on the malpractice environment and claim expenses. So, in the mid 90s, your average dental malpractice case cost about $19,000. By the mid 2000s, that had gone up to about $39,000. And in today's dollars, we're in excess of $100,000. So the severity trend is heading in a upwards trajectory, and lack of informed consent or ineffective informed consent has a big impact on that. In our MedPro dental claim evaluation, about 23% of all of our cases were impacted by lack of or ineffective informed consent, and 22% of all of the dollars paid were impacted by it. So informed consent plays a big role from a dental malpractice claim standpoint.
Okay, so tell me a little bit more about the informed consent process and how it just works in general.
Well, and you stated that correctly. It's the informed consent process. All too often, and this is in healthcare in general, but particularly in dentistry, we get caught up in the form side of things. And the saying that we use is that it's a process, not a form. And we genuinely mean that. Effective informed consent is shared decision making. We want patients to be actively involved in the process of informed consent. That's a back and forth discussion where the patient is participatory in the process of understanding what they're about to undertake. As I mentioned, informed consent is significantly underutilized in dentistry. We know that there is an opportunity to more effectively implement the informed consent process. And if done correctly, we'll have a more engaged and more involved patient population. And then, as I mentioned, hopefully be able to avoid some of the frequency of dental malpractice claims. We look at informed consent as a claim prevention tool as much as we do a claim defense tool. So when the informed consent process is effectively deployed and you have a patient who is engaged and involved in that back and forth discussion about the risks, the benefits, and the potential alternatives to the particular procedure, we see that you get a patient who understands the process much better, understands the potential procedure much better, and we think that that can have a significant impact on the potential for a malpractice claim being filed.
Do you have any key points for dentists to remember when it comes to informed consent?
Yes, I think that you can kind of run down, a list of things to remember during the informed consent process. First is to explain the risks, the benefits, the alternatives, and make sure that each of those gets a fair shake. It's really easy to talk about the benefits. It's a little bit easier to talk, about alternatives. But the risks are what we need to make sure that we're discussing. You don't have to be a fearmonger. You don't have to overdo the risks. But discussing the potential risks of a procedure with a patient is something that should be done. You can't get their true buy-in, and it's not a true shared decision-making process if you haven't discussed the potential risks with the patient. So promote it as shared decision-making. Ensure that the patient understands the information that they receive. And use visual aids when possible. We're seeing a really effective use across healthcare in general of the use of animation and visual aids to promote understanding with patients. A lot of people are much better learners when they can visualize what you're trying to explain to them. The example that I like to use is the prep for a crown, for example. Patients don't understand what that process involves. And so if you approach informed consent as shared decision making, if you look at it as a process as opposed to simply signing a form, you've knocked a lot of the potential issues and negativity out of the way. If you then can also use animation or visual aids, I think we've taken that process as far as we can get, again, with the objective of having an informed patient, letting them understand that there are known risks to whatever particular procedure it may be, and hopefully putting us in a position where if one of those risks does unfortunately arise, we don't get a patient who's automatically looking to file a malpractice claim.
Right. So, are there any common mistakes you see within dentistry that you can kind of give some tips to dentists on, what to try to avoid?
Well, in dentistry, the biggest issue is not, implementing any type of informed consent process. It's significantly underutilized in dentistry, where we have cases where there's no informed consent. There's not a signed form. There's no documentation in the dental record of any discussion. The extent of the informed consent process in some of these dental cases that we have is open your mouth. And we've got to get past that point. So implementing an informed consent process in your practice is probably the best advice that I can give, and is probably the biggest issue that we see right now. There is a spectrum too. I mean, the extent and the level of your discussions and of the informed consent process depends on the in-depth nature and the potential risk of the procedure. If you're doing, a filling, the process doesn't need to be as in-depth. If you're doing an all-on-4 procedure where you're doing 4 implants, the discussion needs to be much more robust. So I think that drawing a discrepancy between patients coming in and signing a general informed consent form and then a procedure-specific form is probably the last of those hints that I think we could give to make sure that the process is effective. So, general informed consent form, when a patient is signing in at the front, that is not procedure specific like you would have them sign in the back if they're about to have an implant or a crown. So those are probably the biggest issues that we see in the informed consent process.
Okay, and then to make it real, do you have a case study, an example of where you've seen lack of informed consent or ineffective informed consent contribute to a malpractice lawsuit?
We have. Unfortunately, we have plenty of examples, but I think that one of the examples that I use most often, because it really draws the point, is we had a patient who came in that required some crowns. It was actually on 4 different teeth. And this was a case that didn't end up even paying any indemnity, but it shows the importance of the informed consent process as a claim prevention tool. What they did was they crown prepped 4 of this gentleman's teeth, and before they could take impressions, the patient had to use the restroom. And so they took a break, the patient went into the restroom. While he was in there, he looked in the mirror and saw that what had happened. Yeah. They had no discussion up front, there was no informed consent process at all, no discussion. And the patient saw that they had prepped his teeth, which is basically, grinding them. And the patient was angry. He exclaimed, "You grinded my teeth down to nubs." And I know that this is an example that's over the top, but it makes the point that dentists come to work on a daily basis. And their office and the procedures that they perform, that's a well-oiled machine. But to most patients, it's a chaotic mess. And they don't understand what a crown entails. And that's the benefit, that's the value from the informed consent process. Having that discussion, truly getting buy-in from the patient can avoid those types of scenarios unfolding where a patient has no understanding of what they're about to undertake, and then they see that their teeth have been prepped and they're furious about it. Again, an over-the-top example, but it really makes the point of the importance of proper and thorough informed consent.